Hi everyone, welcome back to my channel. So today I wanted to talk about the new DOGE department and its possible effects on Medicare and Medicaid. If you are disabled and chronically ill, you are more than likely on Medicare. If you are low income, you are likely on Medicaid. And there are a lot of us that fit both of those two criteria, and we are on both of these programs, Medicare and Medicaid. I fall under that category. I am receiving both of those programs. This is basically our healthcare system for those of us that cannot work, or for seniors. Once you're retired, then you receive your Medicare and your Social Security benefits. So what is the purpose of DOGE? DOGE is supposed to go into all these different government agencies to identify fraud, waste, and abuse, and basically, cut all of that out to save money, right? That's sort of, what they're telling us that this new department is doing. Fraud, waste, and abuse have always been a concern, and it was actually addressed under Obama. And there have always been departments in the government that have addressed and that have tried to look for fraud, waste, and abuse. I myself have noticed that a lot of my correspondence when it comes to Medicare, Medicaid, EBT, which is food stamps, a lot of that correspondence is always asking people to learn how to identify fraud and to be very, very careful, with your cards, your Medicare card, your EBT card, to make sure that you don't, that it's not stolen, that there's no fraud happening. Obviously, this is probably talking about different types of fraud, but I know that fraud is a big deal to these for these programs. And it's not like they're ignoring it. They're even alerting, the people that are using these programs to be aware of fraud and abuse. So it's not something that's being ignored. I can tell you that much. What a lot of people are, and some politicians are saying is that this DOGE, Department of Government Efficiency, is actually a bit of a cover-up. It's a bit of a, they're saying that they're going to identify fraud, waste, and abuse, but they are actually, going to make cuts to these essential programs under the guise of, this is fraud, or this is waste, or this is abuse. And, there have been Republicans that have proposed cuts to Medicaid. And, this is kind of like the perfect, front in order for them to accomplish these cuts by calling them by another name, right? By saying, this is wasteful, this is fraud. It's, this isn't actually, legitimate spending. This is bad stuff. So there are a lot of people that are saying this. The DOGE team does appear to be working with career staff to find more effective ways to address fraud and abuse. So they are working with people that were already working in these departments for Medicare and Medicaid, and they're working together. I hope that's what I've heard, and I'm hoping that is the truth. That way, these people that have been doing this already can sort of tell the DOGE team, hey, look, this is, you can cut here, but you can't cut here. Like, if you cut here, it might hurt, the program in this way, or some of the people that are receiving the program. I'm hoping that is the case. But another thing that I've also heard is that they're going to try to incorporate AI into, I don't really know how. I'm guessing they're going to incorporate AI to identify fraud, waste, and abuse. This is just like a rumor that I've heard, but in all honesty, AI is not a perfected technology yet. I know there are a lot of people that are very, very concerned about AI, and they're really worried about, how it can be implemented in the future. But I just don't think it's a perfected technology. And again, it might just be a good cover-up to make unnecessary cuts to these programs. Something else that I have heard. One of the reasons why they want to make cuts to these programs save money, try to find a certain amount of money, is, they want to save the people money, right? And Republicans have a certain number amount that they need to find, to save. And in these departments, they're not going to find, just by identifying fraud, waste, and abuse, it's not going to be enough, right? It's not going to be enough money to, fulfill this number that, conservatives have. So they would have to do bigger, more sweeping cuts in order to accomplish, to get to that target amount. But one thing I was listening to, I saw a live stream by AOC, and she was talking about how, and again, this is, I'm not saying that this is fact. These are just the different stories, that I've heard from different politicians, from different news outlets. One interesting thing that AOC mentioned was that the billionaire tax cuts are going to expire this year. So they're expiring in 2025. And the purpose of, trying to make these cuts or trying to find this certain amount of money that they need to take from these programs or cut from these programs is in order to allocate it so that they can afford these tax cuts for the very wealthy. So essentially, we can't give these tax cuts to these very, very wealthy people unless we take the money from somewhere else, right? Because then we're paying out double the money. We're losing double the money. So they're targeting these programs that actually help, low income people that live on a fixed income, those of us that are chronically ill. And, it sounds just so awful to me that, I can't even believe it. I wouldn't even, I don't want to believe that this is what they would do to us, those of us that are disabled and chronically ill and, the elderly. But that seems to be the belief that, a lot of people on the left have, is that they're trying to, take this money from these other programs to make sure that the, super wealthy have, so that they can afford to give the super wealthy their tax cuts. Obviously, my concern is for those of us that are chronically ill, because I think, for those of us that are disabled, whatever our disability may be, chronic illness, or, any other physical disability, I feel like we would sort of be the initial target, because people that are on Medicare and receiving Social Security are typically seniors. And that's what you're entitled to. After a lifetime of work, you're entitled to those benefits. You've paid into that, so you're just getting your money back. For those of us that are disabled, though, especially younger people, I do worry that they would go in there, and especially if it's going to be some kind of an AI situation, that they would look at our age and say, okay, well, why is this person disabled? This person is still working age. This person is still young. I mean, this is just a hypothesis, right? This is just my own, guessing how this system would work because they need to cut a certain amount of money, and it's a very, very large amount of money. They would, this would only be a fraction of that amount. So, cuts would have to be sweeping and pretty large. So I worry that we're going to be targeted because of our age, and because it would be easier to make it look like fraud, as opposed to somebody that is retired. You retire at 65 and you get what you paid into, right? There were some things, there was a press conference with Elon, I think yesterday or the day before, where he said that they had already identified a lot of the fraud, that, people that were 150 years old were getting paid, were receiving payments, and, all this weird stuff. Again, not presenting any evidence. And that's one of the issues that a lot of us are having right now, is that there's no transparency, that they can't show us exactly where they're identifying these issues. Where did they find these people that are 150 years old that are receiving these benefits? So a lot of people are very doubtful that that what he's saying is true. And this is just, this is just pertaining to Medicare and Medicaid. There are other programs that they're cutting that are also, crucial, but I'm focusing on this because those of us who are sick, I have doctor's appointments lined up for, I have one upcoming in next month, and we'll, hopefully be going on a waiting list for another one that could take a few years for me to get to. I need my medical benefits. I need my medical coverage in order to to get to these appointments. And it's just, I've been uninsured before. I know how crappy that is. I know how much, you just hemorrhage money completely. You just empty out your bank account when you don't have insurance. So I think this is just worth talking about, and it's worth thinking about, especially if you live here in the United States, because this is, it's concerning. It's making me a little bit nervous, given that I rely on Medicare for my medical attention. And I've never had this level of security when it comes to my health issues before, because I've either been uninsured, or I've had like an HMO where I couldn't see very many doctors, or I was just constantly blocked from seeing doctors or specialists. I was married for a while and I had decent insurance, but unfortunately that also, I relied on my husband's employment, or me being married to my husband. And that also, there was a level of insecurity there. Having Medicare is just, there's a level of security to it that, that has allowed me to save money, that has allowed me to kind of, get back on my feet, so to speak. Obviously I'm not, my illness has not gone away, but there is a level of security. And then also having Medicaid, because Medicare doesn't cover certain things. For example, dental, I get that covered through, Medicaid, which is great. So, there is plenty of worry about what this is going to mean for me and for other people that are disabled. But, so far I'm hoping that they don't make major cuts. We don't really know what that's going to look like yet. And so it's kind of like a wait and see type of situation. But if you guys have any more information on this whole situation, go ahead and leave it down in the comments. I'd like to hear everybody's opinion, how you guys are feeling right now, especially if you're in the US. If you're not, you can, I don't know if you guys are watching, you can let us know how you feel also from other countries. But yeah, that's just my take. Please like and subscribe, and I will see you in the next one. Take care.